Today I'm going to show the major bony landmarks for this lab and the hip, the big spots that you're going to want to learn how to palpate. So the first thing when you evaluate someone's hip, you're going to want to look at them in the standing position, both in the front and the back, just so you have an idea of how it basically sits normally when they are in weight bearing. And then you can also evaluate them when they're lying down as well, just to see what the orientation is. First thing you want to find right off the bat, or I think is easiest to find right off the bat, is the AISS's. So your anterior superior iliac spine. Usually on lean individuals, you can see them. They're pretty prominent, especially when they're lying down. But even upright, you can see them in some individuals. People that are a little bit larger, have more subcutaneous fat, you might have to feel around a bit. But it's going to be right here at the beginning of that inguinal area, so you can almost always just come right at it. So that will be a good one to find, because from here you can really direct yourself to any other spot. This is also where the sartorius attaches, so if you have the suspected avulsion, then you're going to want to palpate these areas here. So from here, you could come down to the pelvis. You can come down into the lower hip area near the pockets, and this is where your greater trochanters are going to be. I see a lot of people make the mistake of palpating the greater trochanters up higher, or looking for them up higher. This is still going to be your hip area, where your hip bones are. Remember that your femoral necks, they come in an angle, and the heads are going to sit inside the hip like this. So the greater trochanter is actually a little bit lower than what a lot of people would intuitively think. So it's the real big bony area right here. And this is going to be an important spot. A lot of muscles attach here. We have all the external rotators that come from the back and attach on the greater trochanter. The IT band goes over top of the greater trochanter. It originates at the tensor fasciolata and comes down. And that's where you can hear or feel some snapping, popping associated with IT band tightness. Also, it can be very tender there if you have IT band problems. So that's where your greater trochanters are going to be. Coming back up to your AISS's, you can then now palpate from there. This side. You stay where you're at. You can palpate up to the top of the iliac crest. And sometimes you actually have to dig in here, so make sure your fingernails are nice and clipped, or use the pads of your fingers to really find the crest. Okay? And the one thing that you want to do with the hip is look for symmetry. So when you're looking at the ISS's, are your thumbs in line with each other, or is one higher than the other? Same with the iliac crest. Once you can palpate, find the iliac crest, then you really want to dig in there, find the tops, and see, like, are they level? That's going to tell you a lot about how their hips are sitting, how their musculature is potentially balanced or unbalanced. Now, for guys, their hips are more narrow, so you're going to find yourself pretty high up into the abdominal region to get to that crest. Okay? Women have wider hips, so typically theirs are a little bit lower. So you really want to really follow your way up to truly get the top of that crest, and sometimes it's difficult to do. From the crest, we can now turn and do some of the palpations that are on the back side here. So here are the tops of my crest, my iliac crest right here. From there, I can continue to follow those down until I get to the area in the back where we naturally have these little dimples. And they're fantastic because that happens to be right where your PIS, your posterior superior iliac spines are located. So you can put your thumbs right in there. You can feel where that sacrum is sitting inside those ilium. So here is my PISS. From here, I can start to palpate and understand where that sacroiliac joint is. So if my crest is coming down here, my PIS is here, then I know that this is where my sacroiliac joint is going to be, in these areas here. And so the other thing that you really want to do Because this is such a great anatomical landmark for the back side of the hip, is to put your thumbs in there and make sure that they're level, that one's not sitting higher than the other, and you could be thinking that you might have some muscular imbalances if that's the case. The other thing that you can do here is really locate where that sacrum is. So if I know this is my PISS, then yeah, I can just basically put the palm of my hand here and I'm on the sacrum. So this is going to be the sacrum associated with that sacroiliac joint. From there I can come up in the middle portion here and I can start feeling around for those lumbar vertebrae. And that first real prominent one that you're going to feel, that's going to be your L5. And then slightly up from there, you're going to feel your L4 vertebra. And that's going to be the two big ones that you're going to need to palpate, as they're often associated with a lot of lower back issues. So those would be the palpations for that side part of the hip. The other palpation we have listed on the lab is the ischial tuberosity. So the ischial tuberosity is going to be the one where your hamstrings come in and attach. And it can be rather hard to get to, especially if you have a larger person that has a lot of subcutaneous fat, or someone that's very musculature as well, or has a lot of musculature. It might be hard to get to that. But essentially, you want to come up the back of the thigh, right where you start to hit that gluteal fold, and then honestly, you just want to dig in there until you can feel that ischial tuberosity. And that's going to be where your hamstrings insert. So it's kind of an invasive palpation, but it is important in case you suspect that there is some sort of an issue with the ischial tuberosity, such as a hamstring avulsion. The other thing you can do to make it a little bit easier, you can ask your patient to lie down on the table.
Stomach?
Yeah. Prone on their stomach. You can actually, you slide back. Have them kind of bend their knee up a little bit. Now you can come in here and really put your body weight and leverage into it to actually feel that spot really nicely. So that's, if they can get into this position, if you're having a hard time finding it, that's a good place to do it, or a good position to put them in to find it. And I believe those are the palpations for this lab. Yep. So good luck with those.